Hello everyone, welcome back to Senior Health Essentials, your go-to channel for practical, science-backed tips to help us all live longer, feel stronger, and stay sharp to our golden years. Have you ever looked back and realized the signs were there all along, but you just didn't know what to look for? It's a quiet truth many families come to discover too late. Someone they love, maybe a parent, a spouse, or a lifelong friend, began to change in small ways. They weren't in pain, necessarily. They didn't complain. But little things started slipping. They ate less, slept more, spoke less often. Maybe they stopped wanting to go outside, or didn't seem quite themselves. It's easy to chalk it up to just getting older. But what if those subtle shifts were actually the body's quiet way of preparing for something more? Here's the second hard truth. Most people don't die suddenly in old age. The body rarely just shuts down all at once. Instead, it often gives soft, early warnings, months, sometimes even a year in advance. But they're so easy to miss. And by the time we recognize them, we've already lost precious time. Time we could have used to offer comfort, make memories, or simply be present in a more intentional way. That's why this video matters. It's not just about medical science or clinical checklists. It's about awareness. It's about seeing what's really happening beneath the surface and giving yourself the chance to walk this path with clarity, not confusion. With peace, not panic. Over the next few minutes, we're going to walk through 6 essential signs that often appear in the final year of life. Some of them may surprise you. Some you may have already noticed in someone close to you, but didn't know how much they meant. Our hope is that by recognizing these signs early, you'll feel more equipped, not to change the outcome, but to change the experience. Because when you know what's ahead, you can focus on what really matters. Care that's rooted in compassion, time that's filled with meaning, and a goodbye that's filled not with regret, but with dignity, love, and peace. So stay with us. You may not need this today, but one day, you or someone you love will. And on that day, this understanding could make all the difference. Sign #1. Subtle changes in daily function and personal care, the silent decline. Sometimes, the signs don't come with loud alarms or dramatic changes. Sometimes, they show up quietly in everyday things. Maybe your mother, who always kept her hair brushed and her clothes neatly folded, suddenly stops caring about how she looks. Or your father, once proud of taking his morning pills on time, begins to miss doses or seems confused by his schedule. At first, you might think it's just forgetfulness or a bad day. But over time, these little moments begin to add up. This is one of the earliest and most commonly missed signs that someone may be entering the final chapter of life. A slow, subtle decline in how they take care of themselves, both physically and mentally. It can look like skipping showers, wearing the same clothes for days, or struggling to button a shirt. It can sound like confusion over which medication to take, or repeated questions about appointments they once kept with ease. You might notice they no longer prepare meals for themselves, or they forget to eat altogether. And here's the thing, it's so easy to brush this off as just aging. We say things like, she's just tired, or he's earned the right to slow down. But what we're often seeing isn't just a lack of motivation. It's the body and brain quietly beginning to let go. This decline in daily function is often tied to something deeper. Executive dysfunction, early-stage cognitive decline, or a deep fatigue that saps their ability to manage basic tasks. Rather than correcting them or pushing them to try harder, what they need most is gentle, respectful support. A guiding hand, not a firm command. Encouragement without judgment. They may not have the strength or clarity to do what once came naturally, but they still deserve to be treated with dignity. This is a moment to lean in, not to fix, but to accompany. And if you're noticing these changes in someone you love, it's not about panic, it's about presence. These signs don't mean there's no time left. What they mean is, now is the time to show up with understanding. Now is the time to shift from expectations to empathy. Because in this season of life, how we respond to these quiet needs can shape how our loved ones experience their final months, with frustration and fear, or with gentleness, comfort, and care. Sign 2. Significant weight loss. One of the clearest, yet most misunderstood, signs that someone may be in the final stretch of life is something you can see, but don't always notice right away. Maybe it starts with a pair of pants fitting a little looser, or a belt needing an extra hole. Perhaps a favorite meal goes untouched, or dinner portions slowly shrink until they're just a few bites. At first, it's easy to chalk it up to aging or loss of interest in food. But when weight begins to drop without effort or intention, it's often the body sending a quiet, urgent message. Unintentional weight loss in older adults is rarely just about eating less. More often, it signals that the body is no longer absorbing nutrients the way it once did. The digestive system slows, muscle mass begins to shrink, and the body's ability to process and utilize protein declines. You might notice more frailty, difficulty walking, or less energy for basic movement. What's happening underneath it all is a gradual breakdown of essential systems that, piece by piece, are starting to let go. And then there's the appetite. As the body enters this slow winding down phase, the sense of taste may fade. Food that once brought joy now tastes bland or even unpleasant. The brain receives fewer hunger signals. Meals become optional. It's not stubbornness or sadness, it's the body naturally beginning to detach from its need for fuel. For someone approaching their final months, eating becomes less about nutrition and more about comfort, texture, and ease. Sometimes families try to fight this, offering rich foods, ensuring every meal is packed with calories, or adding protein shakes. But when the body is preparing to rest, large meals can feel overwhelming, even exhausting. The better response: focus on what feels kind and manageable: soups, smoothies, sips of water, a favorite snack, even if it's just a bite or two. These small comforts can bring more peace than forcing another full plate. If you've seen this kind of weight loss in someone you love, especially when combined with fatigue or less interest in food, it's time to gently take notice. This isn't just about numbers on a scale, it's about how the body speaks in its final season. And when we learn to listen with understanding, we can stop trying to fix what can't be reversed and start supporting what truly matters: dignity, comfort, and being lovingly present through every remaining day. Sign #3. Extreme fatigue and weakness. There's tired, and then there's the kind of exhaustion that settles deep into the bones. The kind where even lifting a spoon feels like a chore, where getting dressed becomes an uphill climb, and where simply sitting up leaves someone breathless. If you've ever watched a loved one go through this, you know exactly what I'm talking about. This isn't laziness. This isn't needing a nap. This is the body slowly conserving what little energy it has left. Extreme fatigue and physical weakness are among the most profound signs that someone may be entering the last stage of life. And unlike normal tiredness, this kind of fatigue doesn't go away with rest. In fact, no amount of sleep seems to restore what's missing. It's because the body, on a cellular level, is shifting its priorities. As organ function declines and circulation slows, oxygen doesn't reach the muscles as efficiently. The heart begins to work harder for less. Movement becomes draining. Speech, effortful. The simplest things begin to require more energy than the body is willing or able to give. You might notice longer naps during the day, or moments where your loved one seems fine 1 minute and completely wiped out the next. These sudden energy drops are common. Some people begin sleeping more than they're awake. Others lose interest in daily activities, not because they don't care, but because they just don't have anything left to give. And emotionally, that can be just as hard. Many people feel embarrassed that they can't do what they used to. They may pull away from conversations or stop engaging in hobbies that once brought joy, not out of disinterest, but out of sheer fatigue. It's heartbreaking to witness, especially if you're used to seeing that person as strong, capable, always moving. But in these moments, support doesn't look like encouragement to push through. It looks like permission to rest. It looks like turning off the noise, dimming the lights, and offering stillness instead of stimulation. So if you notice someone fading, not in personality, but in energy, don't rush to fix or motivate. Listen instead. Sit with them. Honor what their body is trying to tell you. Because in this season, compassion is not about urging them to do more. It's about helping them do less, without guilt, without pressure, and with all the love and patience you can give. Sign #4. Cognitive confusion and emotional withdrawal. There's something deeply unsettling about watching someone you love begin to drift into confusion. At first, it might just be little things, forgetting an appointment, misplacing their glasses, asking the same question they did just 10 minutes ago. But then you start to notice patterns. They get disoriented in places that used to feel like home. They struggle to remember names of people they've known for years. They seem to lose track of time, of days, even of where they are. And as these signs pile up, something else becomes clear. They're not just forgetting facts, they're fading, bit by bit, from the world around them. These aren't just signs of normal aging. What you may be witnessing is the brain receiving less of the oxygen and nutrients it needs to function properly. And when that happens, decision-making, memory, even basic recognition start to falter. It's like trying to tune into a radio station, but the signal is fuzzy. Sometimes they're sharp, present, aware. Other times, they seem far away, even when they're right in front of you. But perhaps even more heartbreaking than the mental lapses is the emotional withdrawal. You begin to notice they talk less. They stop calling friends. They sit through family gatherings in silence. It's not that they don't care, it's that connecting with others, finding the right words, keeping up with conversation has become exhausting. So, little by little, they pull back. They retreat into long silences or quietly excuse themselves from the room. Their moods may also shift in ways that are hard to predict. One day, they seem unusually irritable, snapping at things that never used to bother them. The next day, they may be anxious or restless. And sometimes, they seem unnaturally calm, detached in a way that doesn't feel quite like them. It's not just their memory changing, it's their whole emotional presence. So what can we do when someone we care about starts showing these signs? First and foremost, speak gently. Try not to correct them harshly or show frustration when they repeat themselves. Instead, offer reassurance. Let them know they're safe, that they're loved, that you're not going anywhere. Try to surround them with familiarity, old family photos, favorite songs, routines that bring comfort. The goal is not to snap them back to how they were, but to help them feel secure in the moment they're in. And as you walk with them through this confusing chapter, ask yourself, how would I want to be treated if the roles were reversed? Because at the heart of it, this isn't just about memory loss. It's about preserving dignity, offering patience, and showing love when it's needed most. Sign #5. Frequent infections and slow healing. Sometimes the body speaks to us in whispers long before it shouts. And in older adults, those whispers often come in the form of frequent infections, small illnesses that seem to keep coming back, each one chipping away a little more at strength and well-being. You might notice a lingering cough that never quite goes away, or a urinary tract infection that returns just weeks after it cleared. Maybe it's a skin rash that takes forever to heal, or even a simple scrape that turns into a stubborn sore. And you begin to wonder, is this just bad luck? Or is the body trying to tell us something? As we age, our immune system naturally weakens. It doesn't bounce back the way it used to. This means viruses like the flu or common colds can hit harder and hang around longer. Pneumonia becomes more dangerous. Even oral infections or gum disease, which might seem minor, can quietly drain energy over time. And when an infection does take hold, it often takes longer to heal, because the body simply isn't as quick to respond. Medications that once worked well might not be as effective anymore. Doctors may need to turn to stronger antibiotics, and even then, the recovery may be slow and incomplete. There's another layer to this that often catches families off guard. In seniors, the first sign of infection isn't always a fever or cough. Sometimes, the first sign is confusion, a sudden slip in mental clarity. A once sharp mind becomes foggy or withdrawn overnight. And it's not always obvious that an infection is the cause, but it often is. That's why being attentive to these subtle changes in behavior is just as important as watching for physical symptoms. And then there's the issue of wounds, chronic ones, like pressure sores, that just don't seem to heal. Poor circulation, fragile skin, and reduced immune function all play a role. These wounds aren't just uncomfortable. They can be dangerous. Left untreated, they may lead to more serious infections or even hospitalization. So what can be done? In many cases, aggressive treatment may not be the best answer. Sometimes, comfort care, keeping the skin clean and well moisturized, ensuring hydration, reducing stress, and supporting good nutrition can go a long way. Gentle attention, rather than invasive intervention, often makes a bigger difference in quality of life. If someone you love seems to be healing more slowly than usual, or falling ill more frequently, it's worth taking a closer look. Because these aren't just physical problems. They're signals, quiet but urgent, that the body needs more care, more protection, and more compassion than ever before. Sign #6. Major changes in breathing and circulation. There comes a point in many journeys, especially near the end of life, when the body begins to speak in different ways. One of the most noticeable signs that something deeper is shifting is a change in breathing. You might hear it before you fully see it. Breathing becomes irregular, sometimes rapid and shallow, other times with long, unsettling pauses between breaths. This pattern is known as Cheyne-Stokes breathing. It can be difficult to witness, especially when you're not sure what it means. But in truth, it's one of the body's ways of slowly letting go. Often, the breath becomes more labored even with the smallest movements. A short trip from the bed to the bathroom can leave a loved one gasping for air. They may start to breathe more through the mouth than the nose. Many begin to sleep propped up on pillows because lying flat makes it harder to breathe. You might hear a soft gurgling sound in the chest or throat, fluid starting to settle in the lungs. And while it may sound alarming, it's not necessarily painful. Still, it's a sign that circulation is slowing down and the body is no longer processing fluids as it once did. You may also notice changes in the skin, cool hands and feet, a pale or bluish tone that appears almost marbled. This mottled skin is another indication that blood flow to the extremities is decreasing. It's not uncommon, and it doesn't necessarily mean that death is imminent. But it does mean the body is entering a more delicate state, where energy is being conserved, and the focus shifts from healing to comfort. And that shift matters, because in these moments, our priorities change too. Rather than trying to reverse every symptom, the goal becomes relief, comfort, dignity. Simple things begin to make a real difference. Keeping the room cool and well ventilated, using a humidifier to ease dryness in the throat, offering small sips of water or ice chips to soothe the mouth. And in some cases, oxygen therapy may be prescribed not as a cure, but as a comfort measure. These signs are not failures. They're natural. They are the body's gentle transition, signaling that rest is coming. And in those moments, being present, calm, loving, attentive, is the greatest medicine we can offer. Because while we may not be able to change what's happening inside, we can change the way someone feels, safe, seen, and cared for, right up to their final breath. As we come to the end of this journey together, it's worth taking a moment to reflect, not just on the signs we've discussed, but on what they truly mean. Recognizing the 5 major signs that the body is approaching its final chapter doesn't mean we're giving up. In fact, it's the opposite. It means we're choosing to care differently, more thoughtfully, more lovingly. We're making space for what matters most when time becomes more precious: comfort, dignity, and presence. Too often, we fall into the trap of trying to fight every symptom, fix every decline, chase every possible treatment. But when we recognize that the goal is no longer reversal, but relief, that's when everything shifts. That's when the care becomes more human. That's when the heart leads. And that's also when some of the most beautiful moments can unfold. Because even in the quiet decline of the body, something sacred is still happening. There are memories still to be shared. There are stories that deserve to be told one more time. There are hands to be held, laughter to be heard. Sometimes, even just sitting beside someone, saying nothing, but simply being there, fully present, is the greatest gift we can give. If you've ever walked this road with someone you love, you know what I mean. You've seen how a single touch, a whispered prayer, or a shared photo can bring peace in the most tender ways. You know how important it is to slow down, to choose presence over panic, and to create a space where love can speak louder than fear. If you're facing that path now, I want you to hear this clearly. You don't have to have all the answers. You don't have to fix what cannot be fixed. Your calm, your voice, your kindness, that's what matters. Your loved one may not remember every word you say, but they will feel your love. And if you're watching this video not because you're in this moment right now, but because you want to be ready one day, that's an act of care in itself. Because preparing isn't about predicting the end. It's about protecting the quality of life in the time we do have. It's about recognizing that death, while inevitable, can also be a doorway to connection, to tell the truth, to legacy. Every sign we've talked about, from changes in appetite to cognitive shifts, from infections to altered breathing, is an invitation, not just to act, but to love more intentionally, to be fully present in the season you're in, and to trust that even in letting go, you can still hold on to what matters most. So take the time, share the stories, look into their eyes, laugh if you can, cry if you need to, and above all, be there. If this video offers you comfort, clarity, or courage, please subscribe to our channel. It helps us keep creating meaningful content that truly supports families like yours. Don't forget to like this video, leave a comment with your thoughts or experiences, and share it with someone who might need it today. Subscribe now so you won't miss what's coming next, because we're here to walk this journey with you.